So I'm Sarah Harriman.
And I'm Mikey Weaver.
We had our daughter May Jane Weaver in September of 2020, and she tragically died at 12 days old.
My name's Nadine.
And I'm Todd.
And we're the parents of Carter James Robinson, who was stillborn on the 19th of April 2021. We were 36 weeks pregnant with Carter, a normal, carefree, essentially, pregnancy, and his heart just stopped beating.
My name is Rachel and I am mum to Eva. She was born prematurely at just under 24 weeks and she died when she was 8 days old.
So my name's Colleen and my daughter's name was Violet. We lost Violet in October last year from neuroblastoma, so she had cancer. It was a really long journey for us. It was 6 years.
My name's Kyla and this is Todd, and we lost our daughter Molly to Turner syndrome on the 7th of October last year. We had to terminate for medical reasons just into our second trimester, which was really difficult.
I'm Emma Jane.
And I'm Roddy.
And we lost two boys, Samuel, aged 5 weeks in 2010, with a condition called CHARGE syndrome.
And then 2 years later, we lost our son Ben when he was 6 years of age, 5 months after he was diagnosed with a brain tumour.
I think I feared most that I didn't know how I would keep going, or if I wanted to.
I think I feared that I would feel that way forever and to such an intensity, and that there would be no reprieve from that kind of sadness and grief and being bereft, and just that was my life then, that this was how I would feel for the rest of time.
Yeah.
So we have 2 other children. I feared most for them and how they would manage. My other daughter is 2 years older than Violet, and they were really close. So I really feared for how they would cope at such a young age, having gone through already so much, and then having her pass. That was really tough.
Because we had already gone out and told everybody that we were pregnant, and having to then go and tell everybody that, it wasn't happening it hurt a fair bit. But
Termination for medical reason is so taboo, and the fear around people judging you and whether or not your grief is as valid as somebody else's is something that I think, for me, I struggled with a lot.
We really struggled with people saying to us, "You're doing so well, you're doing really well." And we had no idea what that meant, because to us, we were completely falling apart.
We were struggling.
And we ended up saying to the social worker, "We just don't really understand what you're talking about. So you're going to have to give us a little bit of context about what not doing well looks like." And so then she actually outlined for us,
that was good.
You're not doing hard drugs, you're not abusing your children, you haven't abandoned them in the street. And then we thought, we actually are doing pretty well. Yeah, fair play.
Getting out of bed.
For me, I was quite fearful of going in for a 3rd C-section, and then obviously having the outcome of knowing that he had passed. So I remember that while Todd was there, one of the nurses held my hand as well on the other side throughout the entire C-section and talked me through every step of what they were doing, because I felt like I needed to know, including, when he was coming out, and then having him, and then the procedure going forward. I felt like I needed some level of knowledge or maybe control in a uncontrollable situation.
Just remember that we're not a number. To a health professional, they may have just come from literally supporting another family, and for whatever reason in their mind, they might think that what that family has just experienced has been a worse version of death or grief or whatever it is, but you can't bring that to the next family. Like, that means nothing to us. We just need to know that these health professionals that are there to support us are prioritising us in that moment.
Sometimes it's great to just see the healthcare professionals' emotion, to see that they do care and that they are sharing a bit of your grief as well is nice.
We've just been so lucky, from our GP to obstetrician. They just listened and were attentive to our needs, and I guess that's what got us through.
Speaking as a doctor, my advice to healthcare professionals is that it is very important, again, to acknowledge the loss. I think from medical school you become very good at taking a history of the patient's presenting condition and their past medical history and family history. And if someone does talk about the loss of a child, what I would say to them is just pause and acknowledge, and in some way recognise what someone is telling you and what possible impact that the death of that child might have had on them, and more importantly, continues to have on them during their day-to-day life.
Definitely using the child's name, asking what the child's name
Yeah.
is, but also asking if they're happy to show pictures of that baby, because I think people who lose a baby or a child, they're as proud as any other parent is of their baby, and you know, every other parent's showing their kids at Book Week, and you want to show off this person that you love, and I think that's really nice when somebody says, "Can I see a picture of her?"
One of the midwives, the photography company wasn't available to come and see Carter, so one of the midwives happened to be a photographer, so she came in on her day off and took the beautiful photos that we have.
I know everyone can't cry for every child that they ever have to care for as a health professional, but certainly in our journey with both Samuel and Ben, there were times when healthcare professionals did actually cry and share with us that they were also sad. That helped. So don't be afraid to show some emotion.